Welcome to the IRA website, your high-speed portal to same-day, patient-specific Down syndrome risk assessment. Developed and administered by NTD Labs, the innovator in prenatal screening. With IRA Online, you may complete your risk calculations for Down syndrome, trisomy 18, and trisomy 13 based on high-sensitivity biochemistry and biophysical markers analyzed within your patient's first trimester. This data management tool is a convenient way to save time for you and your patient and makes it much easier to provide results notification within a single office visit, typically just after your patient has undergone her NT ultrasound exam. The following demonstration will take you through some of the most significant components to this productive data management tool and how it enhances your utilization of the UltraScreen Free Beta HCG PAP-A-NT protocol. In the earlier stages of her pregnancy, 9 to 11 weeks 1 day, your patient will provide a dried blood sample obtained through a simple, safe fingerstick method. Venous blood may also be used, yet dried blood sampling provides a more beneficial way to collect, store, and process maternal serum specimens. Maternal blood samples are spotted onto an absorbent test card either at your practice or at the patient's home. This test card functions as a hard copy data record of the patient's information, including history, billing information, ultrasound dates, and consent. After the blood spot is done, the cards are sent directly to NTD Labs, where they are processed and archived according to protocol. That data and the results of the blood screen are maintained at NTD Labs and are made available to you through the IRA portal when the patient undergoes her NT and optional fetal nasal bone assessment ultrasound exam between 11 weeks 1 day and 13 weeks 6 days. This portal is secure and compliant with patient privacy guidelines. Using the IRA portal is simple and extremely user-friendly once you have set up your account. You simply enter the site through your internet browser and verify your account username and password. To find your patient, click on Manage Patients in the navigational bar at the top of the screen. Click on Edit. A search screen will appear which will enable you to search by several criteria, including patient's last name, first name, physician ID, and report number. Click on the Lookup link to get a list of matching records. You will only have access to records in which a final biochemistry result has been completed. You are also able to see that we have received a patient sample even if the biochemistry results are not completed. However, you cannot view the patient data until the biochemistry is complete. Once you have your patient's record in view, you may enter key biophysical data from the ultrasound exam in the designated fields on screen. In order to enter information about twins, you will need to change the number of fetuses to 2. Results based on biochemistry cannot be provided for triplets or higher-order multiples. In such cases, you will need to contact NTD Labs for NT-only results. Use the Save Patient link to save any changes you have made. Once you have entered all pertinent data, click on Calculate to update calculations without permanently saving changes. This is used to view the effect estimated gestational age and maternal age have on your risk assessment. Click on View Results to see your risk calculations for your patient. You will have the option to print a report after viewing the results. The calculation is done by the IRA software itself, so there is less guesswork involved and less time spent between results report and patient notification. This is where you may view results for Down syndrome, trisomy 18, and trisomy 13. If you wish to fax or email your report, you need to check the appropriate box and fill in the destination fax number or email address. If you run into difficulties at any point, NTD Labs has a user help link at the top of the screen, which will take you directly to a step-by-step primer on this site, where you may also contact NTD Labs' IT department for technical support. NTD Labs holds numerous patents for innovative technologies in prenatal screening. Its achievements in first trimester screening include the UltraScreen protocol for Down syndrome risk assessment, which provides the reassurance most patients hope to receive in the first trimester. Unique in many ways, the UltraScreen protocol utilizes valuable clinical data to reliably assess a patient's risk for Down syndrome and trisomy 18-13. Performed between 11 weeks 1 day and 13 weeks 6 days gestation, the protocol uses accurate analytical data from an advanced immunoassay blood screen, dried blood or venous sampling, and data from a nuchal translucency (NT) ultrasound examination. So there are both biochemistry and biophysical markers involved in the assessment. The maternal blood sample is analyzed for biochemical markers: free beta human chorionic gonadotropin, free beta HCG, and pregnancy-associated plasma protein, PAP-A. The ultrasound exam confirms gestational age and measures fluid accumulation behind the fetus neck, nuchal translucency. These combined markers yield the most sensitive screening results possible at the earliest point during the pregnancy, with a 91% detection rate and a 5% false positive rate for Down syndrome, 95% detection and 0.3 false positive for trisomy 18-13. When a fetal nasal bone assessment is added to the protocol, the detection rate for Down syndrome is increased to 95% and the false positive is decreased to 2%. For more than 30 years, NTD Labs has pioneered the research and development of prenatal screening protocols for Down syndrome, trisomy 18, and trisomy 13. Today, NTD serves universities, medical centers, hospitals, laboratories, obstetricians, and maternal-fetal medicine specialists worldwide, providing risk assessment services that enable more informed medical decisions based on clinical data provided in the first trimester. NTD was one of the world's first clinical laboratories to provide an AFP screening program, a service that identifies risk for open neural tube defects. Annually, the lab processes hundreds of thousands of maternal blood specimens using specially designed workflow cycles and immunoassay systems that ensure accurate documentation, efficient sample handling, and quick turnaround from receipt to final results report. Contact NTD Labs at 1-888-NTD Labs or by email at ntdlabs@PerkinElmer.com.